Let us demonstrate the arteries of the brain which are more important. The arteries of the brain are derived from two sources. The first source is from the internal carotid arteries, each of which enters the skull through the carotid canal. The second source is from the vertebral arteries, which enter the skull through the foramen magnum. This is the internal carotid artery, seen after leaving the cavernous sinus. It ends immediately below the anterior perforated substance of the brain, just lateral to the optic chiasma, where it gives off the middle cerebral and anterior cerebral arteries, in addition to the posterior communicating and anterior choroid arteries. This is the cut end of the internal carotid artery. This is the middle cerebral artery. This is the anterior cerebral artery. This is the posterior communicating artery. And this is the anterior choroid artery. This is the optic chiasma. And this is the anterior perforated substance just lateral to the chiasma at the base of the brain. And this is the cut end of the internal carotid artery just lateral to the optic chiasma. This is the posterior communicating artery. It passes backwards to join the posterior cerebral artery. This is the anterior cerebral artery. It runs forwards above the optic chiasma to gain the medial side of the cerebral hemisphere. Near its origin, it joins its fellow of the opposite side by the anterior communicating artery. This is the medial surface of the brain, showing the course of the anterior cerebral artery. This is the beginning of the artery, as it passes above the optic chiasma. It then curves around the genu of corpus callosum and then passes backwards on the medial surface of the brain as far as the parieto-occipital sulcus. That's to say, about the level of the splenium of corpus callosum, where it ends. It gives off cortical branches to the cortex of the brain on the medial surface of the hemisphere. Its branches cross the superior border of the hemisphere to supply 1 finger breadth of the superolateral surface. Note that this artery supplies the leg and the perineum area, which lies in the paracentral lobule on the medial surface of the hemisphere. It also gives off central branches. These are the central branches which perforate the anterior perforated substance to supply the interior of the hemisphere. This is the middle cerebral artery, arising from the internal carotid artery. It runs in line with the internal carotid artery and thus is more frequently involved by emboli which pass through the artery. The middle cerebral artery at first runs laterally in the stem of the lateral sulcus. Then backwards on the floor of the insula. This is the insula, and this is the middle cerebral artery running on its floor. To expose this artery, one has to open the lips of the insula. Alongside the artery runs the deep middle cerebral vein. The middle cerebral artery gives off cortical and central branches. The cortical branches supply the cortex of the superior-lateral surface, except the uppermost 1 finger breadth, which is supplied by the anterior cerebral artery. These are the cortical branches of the middle cerebral artery, coming out through the lips of the lateral sulcus. The central branches enter the anterior perforated substance to supply the corpus striatum. Hence, they are called striate arteries. It should be noted that the central branches are end arteries as they do not anastomose with neighboring arteries, while the cortical branches anastomose with neighboring arteries on the surface of the cortex. But once they pierce the cortex, they do not anastomose anymore. Obstruction of an end artery leads to destruction of the area of brain tissue supplied by this artery. This is the anterior choroidal artery, passing to the inferior horn of the lateral ventricle. This is the 4th part of the vertebral artery. The 2 arteries unite together at the lower border of the pons to form the basilar artery. Each artery ascends on the anterolateral aspect of the medulla oblongata, close to the rootlets of origin of the hypoglossal nerve. It gives off medullary branches to the anterior part of the medulla. It also gives off the anterior and posterior spinal arteries, which descend to supply the spinal cord. Also, it gives off the posterior inferior cerebellar artery. This is the posterior inferior cerebellar artery, which is the largest and more important branch. It passes backwards with a tortuous course among the rootlets of the glossopharyngeal and the vagus nerves on the side of the medulla to reach the inferior surface of the cerebellum. It supplies the lateral aspect of the medulla as well as the inferior surface of the cerebellum. If obstructed, It leads to what is called lateral medullary syndrome or posterior inferior cerebellar artery syndrome. This is the posterior inferior cerebellar artery in another specimen. This is a medullary branch to the medulla. This is a spinal branch descending to the spinal cord. This is the basilar artery. It runs in the midline of the anterior aspect of the pons in a sulcus called the basilar sulcus. It begins at the lower border of the pons and ends at its upper border by dividing into two posterior cerebral arteries. It gives off pontine branches to the pons, labyrinthine artery, which enters the internal auditory meatus, the anterior inferior cerebellar artery, to the anterior part of the inferior surface of the cerebellum. The basilar artery also gives off the superior cerebellar artery to the upper surface of cerebellum, and then it ends by dividing into the two posterior cerebral arteries which supply the occipital lobes of the brain. This is the posterior cerebral artery. It winds backwards on the lateral aspect of the midbrain to sink into the calcarine sulcus on the occipital lobe of the brain. The posterior cerebral artery gives off central branches which perforate the base of the brain at the posterior perforated substance. And then ramifies on the surface of the occipital lobe. Each posterior cerebral artery receives the posterior communicating artery, which is a branch from the internal carotid artery, thus forming the circulus arteriosus, or the so-called circle of Willis. This circle lies in the interpeduncular fossa at the base of the brain and is formed as follows. First, by the two anterior cerebral arteries, which are joined by the anterior communicating artery. Second, by the two posterior communicating arteries, as they arise from the internal carotid arteries of both sides. Thirdly, by the two posterior cerebral arteries, as they arise from the basilar artery. The importance of this big anastomosis is to allow the blood to circulate between the internal carotid arteries and the vertebro-basilar system, as well as between the arteries of both sides. This is the circle of Willis in another specimen, seen as diamond-shaped. These are the two anterior cerebral arteries. These are the posterior communicating arteries. And these are the two posterior cerebral arteries. Now,